Hi everyone, welcome to week 5 of your Medical Language 2 course. We're going to actually be covering 2 chapters this week, both chapter 22 and 23, although they really just pretty much flow right together. So chapter 22 is all about the practice of pharmacy, and 23 is, I think, called advanced practice of pharmacy. So basically what this is doing is telling you a little bit about the people that work in the pharmacy and the type of pharmacies that they work in. So specifically what you're going to look at in chapter 22 are the similarities and differences between pharmacists and pharmacy technicians. So when we think about pharmacy, we typically think about preparing the medications, dispensing them, giving the public or the patient some sort of drug-related information. And specifically, our pharmacist is the one that's going to be doing most or all of the customer education. We are not going to be giving any kind of advice to patients. So when it comes to giving medical information to the patient, that is the pharmacist's focus. And it's becoming even more so now as we go through the years. And the pharmacy technicians are going to have more of a hands-on type of role in the pharmacy. So we're going to be doing a lot more of the actual compounding of the medications. So specifically, when we think about a pharmacist requires 6 years at the minimum of education. Depending on what type of school they go to, it may be a 4-year university and an additional 2-year PharmD degree. Some schools are all one, and it's a total of 6 years in that particular pharmacy school. But either way, it is a 6-year program. Once they complete that program and they get, to get their PharmD degree, then they have to pass a state and federal licensing exam in order to practice. So you have to register with the State Board of Pharmacy in whatever state you're going to be practicing in. For example, one of the pharmacists that I work with is licensed in 4 different states. So that means she had to take the boards in 4 different states. So it's really important that you understand that they have to be licensed everywhere and registered everywhere. Nowadays the practice of pharmacy requires training in all kinds of different areas. It's not just retail or hospital. You've got to know about ambulatory care, drug information, community information. We have managed care practices out there, long-term care, home health, oncology. You have to know how nutrition fits into all of this. So all of those things are part of that 6-year degree. Typically, the general topics that are covered in that 6-year degree for a pharmacist include chemistry, pharmacology, biopharmaceutics, regular pharmaceutics, microbiology, lots of labs, things like that. In addition, there's an externship. So you're going to actually be in a clinical pharmacy setting. So you're going to be covering things like law and all of that kind of stuff. A lot of times you'll see a pharmacist also has an area of minor study, and that might be in management. It might be some sort of research specialty, things like that. You can get a graduate degree, so post PharmD, you can go back and get a degree in other things other than just pharmacy. A lot of times they will get a master's degree or a PharmD. Maybe they'll get a MBA along with that. Now, the pharmacy technician, on the other hand, are also going to practice in all of these same settings, but they're going to have a little bit of a different role within those settings. And really, nowadays, the focus is on making sure that our pharmacy techs are educated just like our pharmacists are. So we're not going to have a 6-year degree, but we do need some sort of an education, and that's what most states are pushing for, which is why you're in this program. So the Pharmacy Technician Certification Board is the board that actually regulates the activities of pharmacy technicians at that national level. Again, because the pharmacists are going to be focusing on patient counseling, we're going to do a lot of those things that traditionally pharmacists used to do. There is a certification exam that you can take after you complete your coursework. A lot of times that coursework will include internships in different facilities. And once you have your certification, you do have to have it, you do have to do continuing education every 2 years. And that continuing education will include patient safety and pharmacy law. So after you go through these 2 chapters, if you have any questions about the different pharmacy settings or what you might do in those settings, please make sure you reach out to me. You can call me, text me, or email me anytime. Have a great week.